Petrissage is the second group of movements that we're going to look at. I've already used effleurage in order to put the oil onto the skin. Normally you would have sufficient oil to be able to place your hand on the skin, move the skin and then start to slide. But in the case of somebody who's got a greater amount of hair, then you're going to need more oil in order to make sure you don't pull the hair out. If you do irritate the hair follicles and the oil can get inside the follicles, you can set up an infection and you'll get little pin spots all over the legs, which is called folliculitis. We wish to avoid that. The Petrissage group describes movements that go across the tissues. So effleurage was with the fibre orientation and now we're going across. There are several different techniques within the Petrissage group, which you've already seen. And I'm going to begin with the kneading. Kneading is one hand after the other, making small movements in a very localized area, which means I can then move up and down the limb. And I'm taking this time a squat stance, so I can then side move across, almost like a side lunge across, but I've got my pelvis facing the direction of my patient. Start with your hands with your thumbs at a fixed point so that you have this shape. One hand draws a small circle and comes back to the start position. The other hand draws a small circle and also comes back to start position. Contact this time is primarily with that part of the hand, so main fingertips down the outside line there. My thumb is the fixed point. The palm of my hand actually has very little contact. I'm scooping the tissues up. Requires quite a lot of coordination to make a smooth movement, which is why we're demonstrating this on the calf muscle, because it's the easiest muscle to feel that you've actually grasped the tissues. That is my kneading technique. If I wish to get to this side of the leg, I need to lower my squat so that I always keep my hands roughly about waist height. And even though I'm moving around, my hands are maintaining the same rhythm on the tissues. I can move more slowly and more deeply using my fingertips now to pull the tissues, but it's still the kneading movement. It allows me to feed the tissues through so I can feel all the knots and the lines within it. Then I can lighten it and speed it up to help mobilize those tissues. I can at any time include effleurage techniques, especially if I've been doing fairly deep tissue work. And then return to my Petrissage. That was kneading. We have ringing. Ringing is a side-to-side movement. I start with one hand fingertips down, one hand fingertips up. I squeeze the tissues, I lift them off the bone, swap over and back down. Moving my body, keeping my hands central to my body. It's a squeezing technique, so it's highly effective on the circulation, but can be a bit uncomfortable if the muscles are very tight. So that's my ringing technique. And I'm returning now to kneading, mixing them up. I'm now going to do rolling. Rolling goes across the tissues and can be done with the heel of the hand or with the thumb. I'm going to start with the heel of the hand, keeping the limbs still, heel of the hand on, rolling across the tissues and down. Glide back to your start position and down. My upper arm is being kept against my side so that when I'm pushing the tissues, it's coming from my body weight. And returning to kneading. If I were to do the same with my thumb, I need to reinforce my thumb, place it on, support it, and across the tissue sideways. I'm moving much more slowly because it's a much more intense technique and is excellent at identifying tension in the tissues, either from what you can feel with your thumb, although initially your sensitivity to tissue problems may not be that high, but I've got my client's communication with me to let me know if I find anything that's particularly painful. So that's thumb. Without the reinforcement on top, so you can see what I'm doing. I'm sliding across the tissues that way. So that was kneading, passing the tissues from hand to hand, primarily contacting with the tops of my fingers, the side of my hand, and this area remaining fairly free. Then I had wringing, which was the two hands squeezing the tissues as they pass at the top. And then I had rolling, which is lifting the tissues up and across and down. And then I'm going to return to effleurage, because that's me completing Petrissage technique on the lower leg. Now you've seen all the Petrissage techniques, what we'd like you to do is break down each one, practice each technique, film us a short clip of it and send it in.